My name is Dr. Mroueh. I'm a fertility specialist. I've been doing this for almost 35 years. I work at Boston IVF. My office location is in Rochester, New York, and in Syracuse, New York. The recommendation is if you're younger than 36, try for a year. And if you're not pregnant, go see the doctor, the fertility doctor. If you're older than 36 or older, then try for 6 months. And if you're not getting pregnant, see the doctor. Now, if you know that there is an issue, you don't have your periods every month, your tubes are blocked, you don't need to wait 6 months or a year or anything. Just call your doctor immediately because there is an issue that we should be able to manage. Remember, your age is the most important factor. I would recommend if after 6 months of trying you're not pregnant, please call a fertility specialist. And if you know that there might be an issue, you don't have to wait for 6 months. The quality of the sperm does decrease with age, and I'm really talking not 40s or even 50s, more like 60 years old and higher. The quality of the sperm is going to decrease, but this does not seem to affect the success rate of infertility treatment. But at the end of the day, your egg quality is what it is. It depends on your age. It depends on how many eggs you have left. What is your FSH level? What is your AMH level? And that's honestly what's gonna determine, the egg quality. There is a lot of information out there on the internet, that are unfortunately not very reliable. Your egg quality is kind of your egg quality. Definitely, leading a healthy lifestyle, not smoking, watching your weight. There is some information that maybe taking CoQ10 might improve the egg quality. So the eggs are as good as the age that you froze them. In other words, let's assume you're now 45, but you froze your eggs at age 36. Basically, your chances of getting pregnant are almost similar to a woman who's 36-year-old rather than 45 years old. So the age of the egg is really what's important, and what played the most important role is at what age they were frozen. We prefer not to do IVF on women who are 45 years old or older, not because we don't want to do it, not because we don't want to help you, but again, just because the success rate is low. If you take like the national data and see how many women who are 45 years old had IVF and got pregnant, it's usually less than 10%, maybe even less than 5%. So it's not that we're not willing to do IVF. We just don't want to subject you to a process that has very low odds of success. But again, it depends on your specific condition. If your lab work show that you have a good number of eggs, it might definitely be worth a try. It's really a decision between you and your doctors if you want to embark on this journey and decide to proceed with IVF. But usually we do recommend women who are 45 and above to consider donor egg, because the success rate is much better. But again, everybody's circumstances are unique. And we may test you, we may find that you have amazing ovarian reserve, and we may decide that it might be worth a try to do a cycle of IVF. If you're using eggs from somebody who's 20 years old, then your success rate is going to be like a person who's 20 years old. In other words, your success rate is going to be very, very good. Again, as long as there are no other factors that unfortunately resulted in failed IVF cycle, your chances of getting pregnant are very, very good with a donor egg. And that's honestly the way to go. As a woman gets older, we are concerned about complications of pregnancies. For example, women who are older than 45 has a higher incidence of C-section delivery. They have a higher incidence of high blood pressure during the pregnancy, maybe even an increased risk of gestational diabetes during the pregnancy. So it depends how healthy you are before you decide to get pregnant. But this is something, that your obstetrician will do in a preconception visit. They will meet with you before you decide to get pregnant. They will go over your health history and they will advise you what to do. If you're at risk for developing blood pressure complication during pregnancy, that may advise you to start taking, baby aspirin during the pregnancy. So there will be a plan that your obstetrician will put together for when you're pregnant, how you will be followed up, what tests you need to be done, what are the concerns based on your specific medical history. But again, people who are 47, 48 undergo fertility treatment, they do get pregnant, and they do, with either eggs that have been frozen before or with donor eggs. And most of them do have a successful pregnancy. But again, it depends on your starting medical condition. How healthy are you to start with? As long as you feel up to it, there is no age limit. There are things that you need to take into consideration. How old will you be when the kid is going to college? Will you be able to handle a kid? So your age is important from a social point of view rather than from a medical point of view, since you will not be using your egg or carrying the pregnancy yourself. So, if you feel you're 50, let's say, and you're in good health and you're ready to raise the kids and run after them and take care of them, and help them go to college, sure, go for it. Again, thank you so much for your question. I hope I was able, to shed some light on this, I have to say, frustrating process. I wish you all the best. I wish you will complete your families without much hardship. Thank you again for listening.